we are going to have a doctor of physical therapy talk to us now. Her name is Leslie Mukogawa. Leslie is a licensed physical therapist at the Queens Medical Center in Honolulu. Ms. Mukogawa received her doctorate of physical therapy at the University of Southern California and served her residency at Kaiser Permanente. Ms. Mukogawa is a board-certified orthopedic clinical specialist and member of the American Physical Therapy Association. Her clinical interests include sports rehabilitation, orthopedic, and pediatric physical therapy. Leslie, please come on.
Thank you. And I'm here today to talk to you guys about different treatment options that are available for the patient with rheumatoid arthritis. First, we'll discuss what different types of therapies are available and what a patient might expect to achieve by attending therapy. Then we'll discuss ways in which you can protect your joints to help decrease the pain as well as limit joint deformity. We will also talk about ways in which you can conserve energy so that you can decrease your fatigue throughout the day. And then lastly, we'll discuss some signs and symptoms to be aware of so that you will know when to follow up with your physician. So physical therapy has progressed a lot in the last several years. I think many people think of physical therapy as treatments that consist of ultrasound, massage, and hot packs. However, physical therapy has a lot more to offer than that. Our main goal of physical therapy is to collaborate with the patient to help them achieve their individual goals. So one person may want to work on their balance so they feel more stable while they're walking, and another person may want to be able to carry their groceries from the car to the house. So although both patients have the same disease and diagnosis, their exercise prescriptions and their treatment plans are going to be completely different and tailored to the individual. As physical therapists, we're also trained to observe and analyze a person's movement as they perform a functional activity such as walking or lifting. There may be ways that we can make the task easier for them to perform, as well as prescribe any assistive devices which may help the person conserve energy. Physical therapists are also able to assess the need for specialized devices such as orthotics and refer you to the appropriate person such as an orthotist. And then lastly, our most important job is to teach the patient what they may expect with their disease and how they can manage it. Occupational therapy is another type of treatment option which can help the person with activities of daily living. And what that means is they help you with the activities you do on a daily basis, such as brush your teeth, comb your hair, take a shower, use the toilet, and feeding skills. And the occupational therapist is also able to customize an exercise program which is specific to the individual. The occupational therapist is also able to construct splints which are customized for joint protection, and they're going to limit the disfiguration of the joints. They can also help in deciding what types of assistive devices might help the person in their daily tasks. And then lastly, their most important job is also to educate the patient in ways in which they can manage their disease and protect their joints. Aquatic therapy is usually performed with a physical therapist, and the therapist in this setting is going to help develop an exercise program for the individual to help maintain the patient's motion in their extremities, as well as build strength in their muscles. The primary benefit of aquatic therapy is there are very low loads of stress being placed on the joints. So with low loads of stress being placed on the joints usually allows for better tolerance of exercise, as likely there is less pain being experienced. So the overall goals of therapy would be to help the patient decrease their pain, to help increase the joint mobility and range of motion, to minimize any stiffness and reduce joint swelling, to help protect the joints, and then to help the individual reach their goals. So besides the many benefits that we already know about exercise, such as decreasing heart disease, lowering your cholesterol, decreasing obesity, exercise is going to help the patient with rheumatoid arthritis in helping to prevent contractures. And contractures are when you can no longer move your joint in its full range because the joint is stuck in a position. Exercise will also help to improve a person's strength so that they can perform their tasks easier. And then lastly, it's going to help to increase your cardiovascular endurance so that you get less fatigued throughout the day. So an example of an exercise routine that you may see in therapy would be stretching to help maintain motion at a joint, postural strengthening because poor posture is going to increase the stress load on other joints, leg strengthening, which is going to help to improve the person's balance, their ability to walk, going up and down stairs, and lifting objects, And then finally, hand strengthening for those RA patients who have hand involvement. So I'm gonna have you guys go through a few exercises with me today. So the first is we're just gonna do a couple stretches. So the first one is an upper trap stretch. So what everyone's gonna do for me is they're just gonna sit up in their chairs nice and tall. Okay, and then next what you're gonna do is you're just gonna tilt your right ear towards your right shoulder, keeping your face pointing straight ahead, and then you should feel a stretch here on the left side of your neck. What I tell people is to maintain this stretch for 20 seconds. And then after 20 seconds, then you'd come back up to neutral, and then you do the same thing on the other side. Okay, and usually I have patients do this 3 times on each side, which we're not going to do today. But that would be the first stretch. The next stretch is a hamstring stretch, and what I'm going to have you guys do is scoot forward on your chairs. And then what you're going to do is you're going to stick your right leg out, okay, and you're just going to gently bend forward from the hip. Now you can apply light pressure to the top of your thigh so that your knee doesn't bend, and then you should feel a stretch in the back of your thigh. And again, like the upper trap stretch, you're going to hold it for 20 seconds. And then after 20 seconds, you would just switch legs and you would do it on the other side. And again, both of these stretches are going to be completed 3 times on each leg. And you can do it 2 to 3 times a day. Okay? Now, how we talked about poor posture. So poor posture is going to lead to increased stress on other joints. So the first are what we call sitting W's. So what you're going to do, you can either put your hands on your shoulders or just have them up in the air. And what you're going to do is you're going to squeeze your shoulder blades together as if you were trying to get your shoulder blades to touch. Okay? You would hold this for 5 to 10 seconds, and then you would just come back to a relaxed position. Now what you're looking for in this exercise, or what you don't want to do, is you don't want to have your ears or your shoulders inch up towards your ears. So you want to keep your shoulders down and then just squeeze your shoulder blades together. So usually I have patients start with 10 to 15 repetitions, and then you would work your way up to 2 to 3 sets of 10. Okay, and then the second exercise are what we call scapular rows, and these are a progression of the first exercise. And usually what happens is when you attend therapy, we'll usually send you home with some TheraBand, and you would tie it onto like a doorknob or something. You would have the ends hanging out, and then you would just pull back on the TheraBand, again squeezing your shoulder blades together and working on your postural muscles. And then again, people usually start with 10 to 15 repetitions, and they work up to 2 to 3 sets of 10. The next 2 are leg strengthening exercises. So with this exercise, what you're going to do is you're going to make sure that your feet are about shoulder width apart and your toes are pointed straight ahead. And then what you're going to do is you're going to squat down, but you're going to pretend as if you were sitting in a chair. So you want to make sure you're sticking your bottom backwards. Okay, because I think what most people tend to do is when they squat, they push their knees forward. And that increases the stress load on your knee joints, which we want to avoid. So you want to actually stick your butt back like you're sitting in a chair. And so you would just go down and up, making sure not to lock your knees at the top of the motion. And you would do this 10 to 15 times, and then we would work up to 2 to 3 sets of 10. Okay, so the second exercise on this slide is what we call a bridge. And what you would do on this exercise, I normally have patients do it either lying on their bed or lying on the floor if they can get up and down off the floor. But what you would do is you would lay on your back with your knees bent. And then what you're going to do with this exercise is you're going to squeeze your glute muscles, which are your butt muscles. So you're going to squeeze your glute muscles, and then you're just going to slowly lift your butt up off the surface. And then you would make pause at the top, and then just slowly lower your bottom back down to the bed or floor. And again, we would do this 10 to 15 times, working up to 2 to 3 sets of 10. And then lastly, our hand strengthening exercises. So with this, we would use like a TheraBall, and what you would do is you would squeeze this is going to increase your grip strength. So you would squeeze the ball in your hand, usually for about 1 minute on one side, and then you would switch and do it on the other side. And I usually have patients do this while they're watching TV, because it's pretty simple. And then the second is a finger opposition exercise, and this is to help maintain the range of motion in the joints in your hands. So usually what you do is you would touch your thumb to your index finger, thumb to middle finger, thumb to ring finger, and then thumb to pinky. And you do this 10 times on each hand. So as a patient's disease progresses, learning ways in which to protect the joint is important. As I stated earlier, one type of prevention would be by wearing splints, because they restrict a particular motion at a specific joint. There are different types of splints that can be worn. Some may be prefabricated, and then others can be custom made by an occupational therapist. There are also many assistive devices that can be used for everyday activities. And these devices can aid in joint protection, but they can also help the individual perform tasks which may have become hard and more challenging to do due to joint restrictions. And then lastly, a physical therapist can determine if orthotics may be beneficial for the patient and how to obtain those devices. So here's a couple examples of some splints which may be issued to a patient. And the first, this one right here, is a customized splint, which is keeping the patient's hand and fingers from drifting outwards, as that's a common deformity we see in patients with RA with hand involvement. And then the second one, it's kind of hard to see because it kind of blends in with a person's skin tone, but it's right here, worn on the finger. And that's a prefabricated splint, and that helps to prevent the joint from hyperextending. So although it's preventing excessive extension, it's also a very functional splint because it allows the patient to still bend their fingers so that they can grip objects. These are a couple of assistive devices which are going to be used for everyday activities. And the first is a jar opener. So not only is it going to help the patient to open jars, but it's going to prevent the patient from doing this motion with the jar, which is going to prevent that outward motion. And then the second device is a button hook. And so these types of devices are good for patients that may have lost their finger dexterity due to the disease process. These next two assistive devices are going to help aid the patient with walking. And the first is a forearm crutch. So this type of device is good for a patient who may have difficulty gripping a cane, but then they're not quite ready. They don't need the stability that a walker would provide. And then the next is a front wheel walker. And this type of device is a little bit more cumbersome, but it helps to provide more stability with those patients who have impaired balance. And these are a picture of some orthotics and a shoe. And the picture on the left or the picture actually in the middle is a metatarsal pad. And what this is worn under the arch of the foot, like it's demonstrated here. And this is going to help to decrease the pressure on specific joints. And then this shoe, this is good for the patient with RA who has foot involvement. And so this shoe has a large toe box, which allows for decreased pressure on the toes, but it also is going to provide the person with stability and support while they are walking. And so the therapist can decide whether orthotics would be necessary for the patient, and they can either refer you to the appropriate person, but some physical therapists also will make them in the clinic for you. So one factor that is important for the patient with RA to consider is the increased incidence of fatigue with activity. So an activity that was once easy to perform may now require more frequent rest breaks to complete. A task analysis should be performed prior to beginning an activity to determine the demands of the task. And harder tasks should not be completed all at once, rather you want to break it up into shorter activities and then complete it throughout the day. Another option the patient may have to consider is delegating to others when the task may be more than they can handle. And then energy can also be conserved by knowing when to make changes to your exercise routine. So rheumatoid arthritis is a disease in which a person's going to have good and bad days. And so on the days with increased symptoms, exercise should be scaled down to avoid excessive exhaustion. So if you're noticing that you have an increased duration of stiffness in the morning, an increased number of painful joints, you're having more intensity in the joint pain, you're getting tired more quickly and more often, you're having a harder time walking, or if your deformities are starting to get worse, those may be signs that you need to follow up with your physician, because it could be signs that your disease is progressing and he may need to make some medication alterations. And so now what do you do when you have an acute flare-up? So when you have an acute flare-up and your symptoms are active, it's important for you to remember to take your medication and to rest when you need to use your assistive devices, and then to ice the inflamed joint. Thank you.